All right. This is Come On Freeman of We Act Radio here in Washington, D.C. at the Westin Hotel downtown. The Congressional Black Caucus Policy for the People Health Equity Summit. I'm joined here by George Benjamin, Executive Director of American Public Health Association. You just concluded a great panel where you spoke about a lot of the inequities, not only facing black people, but facing this country. America is the only industrialized nation that refuses to provide health care to all its citizens. The other public health issue that was near and dear to your heart, sir.
You know, I was an ER doc from most of my clinical career, and I still very much concerned about this epidemic of gun violence. The fact that we don't approach firearms like a public health, the public health problem that it is, making guns safer, making people safer with their guns, and making the environment safer with it. We have not yet developed the political will to do it. 60% of the people that kill themselves, that would die from firearms, die from suicide. And for the first time in our nation, teens, African-American teens, are killing themselves with firearms at the same rate as white teens. We had all these disparities. The one thing that we didn't have was that whites committed suicide more than African Americans, and now that's changed. That's dramatically changed. So I'm hoping that we can do something about gun violence.
And in closing, what do you feel about the fentanyl epidemic? Is your thoughts on that?
Yeah, the drugs are a real challenge, and they continue to be a real challenge. And we've also struggled with that, both nationally and here in the District of Columbia. And we got to deal with the hopelessness and helplessness that drives substance use in our nation. The current opioid epidemic was driven a lot by overprescribing opioids, but that is built on the base of a whole lot of hopelessness and helplessness. That doesn't go away until we change society and access to a whole range of social needs in our country. And we need a new social compact in health to deal with that in our country.
All right. And thank you, Mr. Benjamin.
Thank you.
All right. And for all the work you do.